Most Nigerians don't know this, and that ignorance is costing lives every single day.
Since 2014, Nigeria has had one of the strongest healthcare rights laws in Africa, the National Health Act, signed into law in 2014. Yet 10 years later, most citizens don't even know it exists.
Hospitals disregard the law, patients are rejected, lives are lost, and the government agencies meant to enforce it look away.
The National Health Act guarantees you rights hospitals don't want you to know. Section 20, you must be fully informed about your treatment options.
Treat first, ask for money later. No hospital in Nigeria, government or private, has the right to reject you in an emergency. Not for money, not for lack of ID, not for any reason.
Accident victims, pregnant women, gunshot victims, stroke or asthma patients, children in danger, all must be treated immediately. That is the first duty of care.
It is illegal for any hospital, even private ones, to demand payment before saving a life. Even gunshot victims cannot be rejected. That's also against the law.
The Act also gives every Nigerian a basic minimum package of health services, free immunization, free antenatal care, free childbirth, free family planning, free treatment at primary health centers, and free emergency stabilization.
The government is required to fund this through the Basic Healthcare Provision Fund with at least 1% of the national revenue every year by law.
So why are Nigerians still dying at hospital gates? Because hospitals ignore the law. The government refuses to enforce it. Corruption drains the funds, and Nigerians don't know their rights.
Women die in childbirth over folder fees. Accident victims bleed to death for 20,000 naira. Gunshot victims get blocked for useless paperwork. Lives that should have been saved are lost.
These two words, shall not, are not a suggestion or an appeal. They are a federal command. No one is allowed to refuse you emergency care. The law is on your side.
If the law exists, if the money exists, if the obligation exists, why are we still paying with our lives? Why are Nigerians still dying? Speak, demand, act. Healthcare is a right.
Why do private hospitals act like they're above the law? Why does the Ministry of Health ignore its duty? Why are PHCs starved while budgets disappear? We shouldn't have to beg for care. The law is clear. Our rights are clear. Together, we can hold them accountable.
Until Nigerians start demanding their rights, until hospitals face consequences, we will keep burying people who should still be alive. Demand your rights. Health should work for every Nigerian.
Share this. Someone's life may depend on knowing this law.
If this message matters to you, hit like.